Unicomplex-M is a multivitamin product that helps treat or prevent vitamin deficiencies caused by a poor diet, certain illnesses, or during pregnancy. Vitamins are important for our body and help keep us healthy. When taking Unicomplex-M, you should follow the instructions on the package or as directed by your doctor. Do not take more than the recommended dosage. Take it regularly at the same time each day to get the most benefit from it. If you have any questions, ask your doctor or pharmacist. If you experience constipation, diarrhea, or upset stomach when taking Unicomplex-M, don't worry, these effects are usually temporary and may go away as your body gets used to the medication. If they persist or worsen, let your doctor or pharmacist know. Your doctor has prescribed this medication because they believe the benefits outweigh the risk of side effects. Most people who use this medication do not experience serious side effects. While it's rare, a serious allergic reaction to Unicomplex-M can occur. Seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. If you're in the US, you can also report side effects to the FDA, and if you're in Canada, you can report them to Health Canada. If the multivitamin you take has iron in it, be sure to store it in a place where children can't reach it. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. If an overdose happens, get medical help immediately or call a poison control center. Before taking Unicomplex-M, it's important to talk to your doctor or pharmacist about any allergies you may have to its ingredients or to soy/peanut. This product may also contain inactive ingredients that could cause allergic reactions or other issues, so it's best to discuss this with your pharmacist. In addition, be sure to inform your doctor or pharmacist about your medical history, especially if you have a history of alcohol use/abuse, liver problems, or stomach/intestinal problems such as ulcers or colitis. If the brand of multivitamin you're taking contains folic acid, it's important to let your doctor or pharmacist know if you have a vitamin B12 deficiency, pernicious anemia, before taking it. Folic acid can affect certain lab tests for vitamin B12 deficiency without treating the anemia, which could lead to serious nerve problems. It's best to consult your doctor or pharmacist for more details. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's important to consult your doctor before using this medication, as it may pass into breast milk and could have an effect on your baby. It's important to be aware that Unicomplex-M may interact with other medications, which could affect how they work and potentially increase the risk of serious side effects. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist. It's also crucial to avoid taking Unicomplex-M at the same time as certain medications, such as antacids, bisphosphonates, levodopa, thyroid medications, and some antibiotics. You should consult with your doctor or pharmacist to determine the best dosing schedule that works with all your medications. Additionally, if your multivitamin contains folic acid, make sure to inform your doctor or pharmacist if you take certain anti-seizure drugs. Lastly, Unicomplex-M may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are taking this medication. If someone takes too much Unicomplex-M and has serious symptoms like passing out or trouble breathing, they should call 911. Otherwise, they should call a poison control center right away. In the US, residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. Make sure to attend all of your medical appointments and lab appointments. Some versions of Unicomplex-M may include additional ingredients like docusate. If you are unsure about the ingredients in your specific brand, be sure to ask your doctor or pharmacist. It's important to note that Unicomplex-M is not a replacement for a healthy diet. It's always best to get your vitamins from nutritious foods. Be sure to maintain a well-balanced diet and follow any dietary recommendations given by your doctor. If you're supposed to take Unicomplex-M on a schedule and you miss a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the one you missed and take the next one at your regular time. Don't take double the dose to make up for the one you missed. Keep Unicomplex-M at room temperature and away from light and moisture. Make sure to store it in a place other than the bathroom and keep it out of reach of children and pets. Do not flush Unicomplex-M down the toilet or pour it into a drain unless instructed to do so. When it is expired or no longer needed, be sure to properly discard it. It's best to consult your pharmacist or local waste disposal company for the proper way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.